Max, Fran hurt her knee in practice yesterday, so I want you to take a look at it and see what's going on for me, okay?
All right. So, Fran, can you describe me what happened?
I landed funny and my whole knee just twisted.
Twisted. So, you were coming down from a jump.
Yeah.
Okay.
My coach took a video of it if you want to watch.
Yeah, actually, that'd be great.
So Max, what are you seeing there?
Well, I saw when she landed coming down from that spike that she definitely had some twisting valgus, which is, as we know, the number one cause for ACL tear.
Okay. So should we do a little more evaluation to determine if she has an ACL tear?
Yeah, I would definitely. There are a few special tests, namely the anterior jaw and Lockman's, that I would perform on her knee to see what we got.
Okay. Okay, Max, so we're suspecting an ACL tear. Let's use the Knee Decide app to show Fran what might be going on.
All right, yeah, sounds good. So, Fran, this is an app that focuses on the knee and many mechanisms. So, with you, we suspect an ACL. So, this video is going to show the general force of how an ACL gets torn. So, that's what we suspect with you, given how you twisted.
Okay.
All right.
So does that seem to be matching up between what's in the video and also what's in the app, Max?
Yeah, based on what I saw, I would say the way you landed and your knee went in is very similar to the video that's shown here on the app.
Okay. So what do we want to do now? Do we want to do some special tests?
Yeah, at this point, we would definitely run through some special tests. I would suggest the anterior drawer test and the Lockman's test to roll in or roll out the ACL injury.
Okay, very good. So Max, you suggested using the anterior drawer test and also the Lockman test to assess her knee to determine if she had torn her ACL. So let's utilize the Core app to determine the quality of those special tests.
All right, that sounds good. So I'm just going to open up this app. So we'll start with the anterior drawer. And so it says there's a sensitivity of 0.20 but a specificity of 0.88, meaning the test has a high specificity but not very good sensitivity.
Okay. So should we probably take a look at the Lockman test and see if it's a better test?
And to compare, the Lockman's test has a sensitivity of 0.85 and a specificity of 0.94. So both those values indicate that the Lockman is a good test to rule in or rule out a anterior cruciate ligament tear.
Okay. So why don't you show me the test? Why don't we do that Lockman test and see how we do?
Okay.
I'll just take this out of your way for now.
Thank you. All right, so first we gotta make sure just the athlete has a nice relaxed leg, all right? So what I'm gonna do is I'm gonna pull it up here and down here, and I'm just gonna pull, all right? And what you hopefully are gonna feel is nothing, but if you feel anything or if it hurts a lot, let me know. And I'm just gonna start and...
Oh, ow,
Not
ow.
good? Okay, so what did you feel?
Pain.
All right, can you describe the pain for me?
It's inside my knee.
All right. And what type of pain? Was it like a sharp shooting pain or dull, achy pain?
I wouldn't say dull, but it's not so sharp either.
Okay.
So Max, I think Fran probably has a couple concerns
All right.
about what's going on with her knee. She might just be a little bit worried about what the surgery is going to be like. Let's try to use that Knee Decide app again to show her what might be going on when she has her surgery.
Absolutely. So, Fran, if you look here, this app is actually going to take you through what a typical ACL surgery would consist of. So, when you start off, those plier-like things are creating holes called portals, which eventually you're going to string the new ACL through, simulating the torn ACL. And what that is showing where you would take tissue. In this case, it's taking it from an adductor muscle. And it's going to use that tissue to simulate your new ACL.
So Fran, do you have any additional questions?
How long is the recovery?
Well, based on what most athletes who go through this, it's going to be between 5 and 7 months. In a lot of cases, it could be shorter or longer, really depending on how your body takes the surgery and how quickly you recover.
So Fran, one of the things that we're going to want you to do right after the surgery is some patellar mobilizations, and I pulled up a YouTube video here that you can both watch to get a feeling for what those patellar mobilizations are going to be like.
Okay. Tom, what are some indications for doing patellar mobilizations?
Well, shortly after the surgery, we want to reduce as much scar tissue as possible. And keep in mind, as time goes on, we're going to want to be able to get that range of motion back. So by moving her patella around, we're able to reduce any scar tissue or limit the amount of scar tissue that's forming around the kneecap, and also making sure that we can fully restore her range of motion as she goes through the rehabilitation process.
Okay.
Okay, Max, so now that we've evaluated Fran, we need to document everything that we came up with in our evaluation. So why don't we use the Core AT, our electronic medical record system, to document everything that you came up with here in your evaluation, okay?
Perfect.
So that's the basic continuum of it. So here's the basic injury. Let's discuss the mechanism a little bit. Let's try to match up the mechanism with what what she's showing on the video as to how she was hurt, and the mechanism as it's described in the literature and also on the app, trying to match those two things up. And that's going to drive our evaluation forward. So our students can kind of see that connection between what actually happened and what has been indicated in the literature as to how someone actually tears their ACL. From there, we're going to do some other evaluative procedures. We're going to do some palpation, and in particular, we're going to utilize our special tests such as the anterior drawer and the Lockman test. The app, it shows the specificity and sensitivity of those particular special tests. So it gives us an indication of what the best special tests are. And what we're trying to do is we're trying to match that up with a gold standard. And a gold standard for determining if someone has an ACL is going to be either arthroscopy, where they actually open you up and take a look inside, and that's usually or an MRI, which is obviously very sensitive and specific as well. From there, we're going to try to explain to the patient what's going on, why the injury happened, what the recovery is going to be like, what the surgery is going to be like, just to try to ease as many of their concerns as possible, answer as many questions as possible. I will say that the iPad and the apps that we are aware of are very helpful for those things, especially when the students kind of get sick of hearing me talk about it. They can go to another source. If they have additional questions, they can always go right here and take a look, whether they're in their dorm or whatever. So it definitely has a lot of uses, both in the classroom but also in the clinical learning setting. It can be a very, very powerful tool.